Hi, I'm Matthew Weinstock with Hospitals and Health Networks, reporting to you live from New Orleans and the 2013 HIMSS Conference and Exhibition. It's been a busy couple days down here in the Big Easy. The exhibit hall has been bustling and the meeting rooms have been packed during some of the educational sessions. There's been a lot of attention towards interoperability, clinical and business information, and mobile health. In fact, you can read a bit more about mobile health in my blog below. But first up is my interview with David Muntz, Deputy National Coordinator at the Office of National Coordinator for Health IT. Muntz, who is a former hospital CIO, discusses the progress the field is making on meaningful use and some of the challenges that lie ahead.
The numbers are way up in every category, and so we're very pleased with the progress. The hospitals have reached a great threshold. The ambulatory care is not as high as we want it to be, but it's moved so substantially, and the question is how to continue that effort. And some of the things that ONC is doing in partnership with the community physicians is very important. The regional extension centers have had some real successes in working with now more than 145,000 physicians, so very hopeful that the advice that we're giving to them and the efforts that they're making on their own behalf and on behalf of their patients will have a great outcome. The complexity of what it is that is ahead is challenging. The rules and regulations that we put out are not always as easy to understand. Sometimes interpretations are different, and so want to make sure that people are doing what they need to do right the first time. So what we're hoping to promote is not just meaningful use, but meaningful conversations that occur prior to implementation, that let people talk about how the psychology will play a part, what the implications are going to be for the workflows, and think carefully through how the impacts will be felt for both the patients and the physicians. A lot of the vendors are very well prepared, and so I'm very pleased with that. And the question is, how are all the pieces going to fit together? So one of the key factors is interoperability, and I think that's one of the places where the greatest focus should be. We are not where we want to be. If we were, everybody would already be sharing information easily. It's not an easy task to do, so we're trying to talk to them about how to get connected, and then how to actually exchange information, and then how to integrate that information into the patient record in a way that makes sense for the caregiver and the patient. Well, we're trying to do everything we can. We're meeting with the vendors. We've had numerous meetings already with the EHR Association. We're trying to lead with our ears and make sure that we're hearing where their concerns are. One of the things that is concern is the workforce and whether or not there are enough people in this industry to do what's necessary, whether it's implementation or project management. And so there are programs that occur and grants that were given, and we're graduating a lot of people from those programs to get the workforce up. But that need will continue, and it's certainly an expected thing. The community colleges are doing a great job of trying to get more people prepared for the industry. The biggest area where I think we're going to see growth is in the business analytics, where once we've gathered the data, we're going to then develop a totally new healthcare-based business intelligence or clinical intelligence that's going to allow people to ask meaningful questions about how the healthcare should be delivered and what makes sense. So I always hope that we will continue to see that stretch. I never want to see us where the demand and the supply are in synchronicity. I don't think that would be enough of a push. What we're asking the vendors to do is actually post the information about the cost of their systems on the chapel. And then we're also having conversations with them about how to purchase. So if you go to healthit.gov, you'll be able to find a lot of information to help in the purchasing. But there are costs that you have that are not always associated with the vendor, and so we need to make sure that we're having a great discussion, a very broad discussion about all of the costs that are associated with these systems, and that hospitals and providers and professionals can take the steps that are necessary to mitigate all the costs. Well, we have a lot of people working on evaluation of where we are, and so I'm a little concerned when I hear people say that we are not doing enough. I agree that we do have a responsibility to study the program and make sure that we're asking all the right questions and that we're sharing the results. But I think the community also has some responsibility. When I talk, I frequently ask people if they've had either a good or a bad experience with an EHR, and of course every single hand in the audience goes up. And then I ask, and how many of you have actually published or shared your results in a public meeting? And the answer is very few hands are left. And so I think we all owe the patient and the community the responsibility, or have the responsibility, to tell the community what it is that we've experienced and to look at whether or not we're getting the expected outcomes and make adjustments if we're not.